Hi, my name is Joseph Patterson. I'm the Director of Marketing for Companion Therapeutics, and I'm here today with Dr. Cesar Contreras. Dr. Cesar Contreras will be speaking with us today on proton pump inhibitors. So, Dr. Cesar Contreras, what are proton pump inhibitors and what are they typically prescribed for?
Proton pump inhibitors are very powerful drugs that work in some special cells in the gastric layer to block the production of hydrochloric acid. When they do it, the production of this acid is really decreased, that could lead people to have hypochlorhydria or achlorhydria. So they are used for those patients that may have gastritis, gastric ulcers, gastroesophageal reflux disease, to prevent or treat ulcers due to non-steroidal anti-inflammatory drugs. For people who have an illness called Zollinger-Ellison syndrome, or to eradicate Helicobacter pylori infection.
Over the last few years, there have been numerous studies that have linked long-term treatment with proton pump inhibitors to numerous adverse effects. Can you talk about these adverse effects and why you think they arise?
Yes, there have been many clinical trials, many observational trials that have shown numerous adverse effects due to these drugs. One of them say that people could have a decreased absorption of calcium, magnesium, leading to osteoporosis and fractures due to osteoporosis. Some others say that the absorption of some vitamins like vitamin B12 could be decreased, and iron will be decreased, the absorption. Could have been seen or demonstrated either other trials that show that they could produce or could make people more easily produce with kidney failure or with cardiovascular disease, mainly heart failure and dementia. So these problems have been arise recently, and that has led to some people to say that patients should not take these drugs. But the fact is that many people are using proton pump inhibitors and they will continue using them.
Now, if someone must continue to take their PPIs, which vitamins and minerals should they be taking to counter these side effects? And can they just take a simple multivitamin?
Well, as I mentioned before, in instance, calcium absorption is decreased. So if people take any calcium salt, it will not be absorbed because they will be in an environment, a gastric environment with a low acidic. So they will need some salts that have a better bioavailability to be absorbed. So it's not any salt of calcium. The same thing is for iron, the same thing is for magnesium. So it's not any one of them. They will need some special salts to be used and to try to prevent the decrease in these minerals and vitamins in their bodies.
So, according to this, would you recommend the user of proton pump inhibitors to, let's say, stop their prescription? Should they continue?
Well, I have seen some interviews of people that say that patients should not use these drugs. I don't agree with them. These drugs are really very powerful, are the best option to treat these illnesses that I mentioned before. What I should suggest is to use them for the lowest concentration possible, for the shortest time possible, and not to use them for anything, because the truth is that people are using them for anything. I have a floating and they use PPIs. I ate something very heavy and I will take a PPI. That's not the use that they should have. So what I'd say is that people should use them according to their medical prescription but not going longer than that. Sometimes physicians prescribe it for 1 month or 2 months or 3 months, and people take it for 1 year or 2 years or 3 years. So they should attain to the prescription that the physician has made.
Perfect. Thank you, Dr. Contreras. Thank you so much for joining us today. For more content on PPIs and the long-term side effects, please visit our website at www.c-therapeutics.com. We look forward to hearing from you, and please remember, like, share, and comment below. Thank you. Have a nice day.